does remain constrained and vulnerable. It says that this could therefore lead to load shedding at short notice. Eskom says the possibility of load shedding does remain high, but will only be implemented if absolutely necessary. Health institutions from across the continent this week gathered at the Blue Waters Hotel in Durban for the first regional Global Green and Healthy Hospitals and Sustainable Health and Procurement Conference. Now, amongst other things, the event discussed innovative and collaborative strategies to foster climate-smart and sustainable healthcare practices. To tell us a little bit more of this, we're now joined from our studios by Luqman Yesufu, who's the Global Green and Health Hospitals campaigner at GroundWork. Thanks so much indeed for joining us. Welcome to the program.
Hello, Peter. Thank you for having me, and hello, our viewers.
All right, so this sounds quite a big thing to be talking about, and people don't often put medicine and health practices with being climate smart. Make the link for us.
Yeah, that's a very interesting question, Peter. I think one of the things that we can't run away from is that climate change is real, and there is this need and this urgency. The World Health Organization and the United Nations has called climate change a global health emergency. So, and the healthcare institutions globally have also, through the medical journal, have described climate change as the biggest global health threat of the 21st century. So it's no longer an environmental issue, it's now a health issue. And one of the major things that we all need to consider is that once people fall sick as a result of climate change, they are going to end up at the forefront of the hospital. So how is the healthcare institutions addressing this? Because they are going to be overburdened by the impacts of climate change. So that's the link.
Yeah. All right. So describe for us some, I don't know, medical conditions, diseases perhaps that start to increase in areas literally due to climate change.
I think one of the links between climate change and diseases, I think I'll just go back and let's just take a step back. I think one of the very important things is that air pollution and climate change are very much linked. In fact, they go hand to hand. And one of the things that we've seen is that as long as we keep on having air pollution, we're going to have those climate change impacts exacerbated. So I'll give you a couple of examples. So we have impacts like extreme weather conditions. And we've seen, I think about 2 or 3 years ago, where we had malaria cases in South Africa, in Limpopo. And these were cases of people that have never ever traveled to malaria endemic areas. So we know that malaria is more prevalent in West Africa. But we've also seen Cyclone Idai that has affected Southern African region. We've seen the impacts. We've seen that it's going to affect migration. People are going to flood other Southern African countries. They're going to increase the burden on our health institutions. So we've also seen the impacts in South Africa, the day zero, where we've seen the drought in the Western Cape and the impacts of that. You know, so how do we, as a health institutions, address those impacts? Because at the end of the day, we have a responsibility. We've taken an oath as health institutions to protect health, to prevent disease. So how is the health institution, you know, tying that link and addressing this is very, very important. So I think that is one of the major factors and one of the major drivers between the Global Green and Healthy Hospital initiative.
All right, so take us through what climate smart and sustainable healthcare practices might look like. What do we need to start doing differently?
Okay, I think the first thing is that the healthcare sector has to recognize that it has an environmental footprint. Environmental footprint in terms of procurement, in terms of how it does the whole procurement. I'll give you an example. The health institution, if you look at the hospital budget sheet, after, in terms of treating, the second largest expense on the hospital budget sheet is on procurement. So hospitals procure a lot of stuff. They procure so many things, and many of these things come in packaging. So how do we package our stuff? So the whole life cycle in terms of procurement is also very important. So the hospital has to look at the whole life cycle in terms of procurement and reduce packaging and ensure that a lot of the things that are procured are environmentally friendly. That's just an example. That's in terms of mitigation. Also, there has to be a form of adaptation. The hospital has to be the last building standing when we have climate change impact. So for example, we had extreme weather events in Durban where we had flooding, and we had cases where all that water was in the basement of hospital buildings. And where is the power, the backup power of a hospital? Majority of the time is in the basement. When you have those extreme weather conditions of flooding, your backup power is gone. So the hospital has to think about a different way of addressing adaptation and preventing, because obviously it can't function without power. Then the last thing is that health institutions have to start advocating for climate resilience. They start advocating for issues that affect people, because the reality is that people who are at the forefront and who will face the burden of climate change are the vulnerable, the poor people. So who is going to speak on their behalf? The health institutions have to start advocating for issues that affect environmental health and, speak about policies, and practices that promote environmental health practices and the adoption of these policies in all government-related activities.
All right, and then perhaps finally, when you look back at this conference, what have been the outcomes and what tangible things have you put on the table going forward?
Yeah, I think that's a very interesting question. So this conference was, it wasn't just a conference, it was a national and international gathering. So we started in 2013 and so far we have over 1,200 hospitals across the continent, active in terms of 95 members. And this was an opportunity for cross-pollination, for sharing of ideas and learnings. And this was an opportunity for members to be able to see how much progress they've made and make further commitments. So we had doctors in the room, we had procurement officials in the room, we had environmental health practitioners, we had engineers, we had architects. And it was an opportunity for everyone to sit around the table and say, we have climate change and we need to act. Because everyone in a health institution, it's not just the doctors that are responsible for care, but even the engineers and the cleaners in the hospital are also responsible for care in one way or the other. So the Global Green and Healthy Hospital provides that platform for this cross-pollination and cross-pollination of ideas between these different cadres of experts. So the opportunity was there on the table for people to make further commitments and to say they were going to make a difference in wherever they are, both within the hospital and within the environment where this hospital is located. So there were further commitments for the next 5 years to make a difference and to also advocate for governments to introduce environmental health policies and practices, and also to promote green technologies, ensure that we do away with dirty energy and we start thinking about renewables, which is really important. We also need to think about how waste is being generated, proper segregation at the source, and ensuring that we prevent waste from going to medical waste incinerators. Because at the end of the day, a hospital cannot sit back and say, yes, we are providing care, but at the end of the day, we are also polluting people and making people sick. So that is one of the fundamental principles behind this, that we all work together to ensure that prevention is really important and not just focusing on curative in terms of care.
Well, thanks very, very much indeed, and we wish you the best of luck, and we hope that this is something that grows around the continent, where sustainable healthcare practices become a norm. Thanks so much indeed for your time. Thank you.
Yeah.
All right.
Thank you, Peter.